Dr. David Broadway from the Broadway Center for Plastic Surgery is one of only a few triple board certified plastic surgeons in the Denver area.
What is your #1 surgery?
The most common thing I do is actually breast augmentation. I do liposuction, tummy tucks, facial plastic surgery, obviously, but the most common request that I have is breast augmentation.
Let's talk about some of the common reasons people come to you for breast augmentation. What are they?
I think that varies as do the patients themselves. Over 250,000 women a year get implants, so you can imagine the reasons they want to have implants is very variable as well. I think it's related to age group. I operate on women from 18 to 65 for breast implants. And I think the younger group have goals of symmetry. They want to look better in clothing. They want to look great in their swimsuits that summer. Women that have gone through nursing and child raising and those kinds of things, they have different issues, and so implants can help them as well.
Now, you have brought some examples here, gel and saline. Let's talk about those.
Okay. There are pros and cons to each of them. Right now, today, you have to be in a study to get a gel implant. That may change. The FDA looks as if it's going to give us permission once again to use gel implants for everybody, but currently you have to be in a study. I participated in a couple of them. The advantages of gel are that they're a little bit softer, they're a little bit lighter in weight.
And the most requested would be gel or saline?
Well, worldwide it's gel, but in the United States, with all the controversy that went on in the early 90s, currently we are putting in a lot more salines than gel. But I think that is going to reverse, and I think it'll reverse fairly quickly.
Now, where do you make the incision? I'm always curious, where do you make the incision for breast augmentation?
Well, I offer 3 different ones, one below the breast, one right around the areola or the nipple area, and one in the axilla or the armpit. I usually go beneath the breast because that incision gives me direct access to the pocket I create for the implant. I have more control of the fold, which is probably the most critical for getting a good result. And the recovery is a lot easier as well. So I do most of mine using the inframammary approach.
It helps with the recovery. It also helps with looking more natural.
I think I can control the fold a bit
That's
better.
great.
Sure.
Okay, now off the air we were talking about behind the muscle. Why do you go underneath the muscle?
Well, in most cases, it's going to give you a more natural look. It prevents the shelf look or the edge of the implant being visible. It makes mammography easier and lower risk for capsular contracture, which is a hardening of the scar band around the implant.
We had a lot of fact or fiction during the commercial before we started here. Let's talk about one fact or fiction question. Breastfeeding. Commonly held feeling is that you can't breastfeed after you have a breast augmentation.
Well, actually, you can. I have a good number of patients that have been able to breastfeed afterwards. It does increase the risk that you may not be able to, but I think the vast majority of women are able to. Another question that women ask me is about the silicone. Does silicone get in the breast milk? And actually, cow's milk has more.
Oh, you're kidding.
Interesting.
So it wouldn't harm the child, then?
No.
Okay. What are some of the risks involved? You know, sometimes you hear, oh, maybe it can cause cancer. Is that true or no?
Well, specifically, cancer's been looked at in great detail, and actually the women that have implants are at a lower risk. Now, why that would be, we don't understand, but statistically, they're at no higher. The next controversy it got into was autoimmune disease, scleroderma, lupus, those types of things. And again, no risk for that. While there are risks associated with any surgery, the risks for breast augmentation seem to be controllable and very unusual.
Okay.
A friend of mine also just called me with a question about sensitivity. I mean, I hear that a lot. A lot of people are concerned whether they still have sensitivity.
It's a risk. I think it's a very small risk, under 1 to 2%. Most of the time it will recover. Can take a couple of years for that sensitivity to come back, but most women do very well without any problem at all. You know, this is one of the most fun things I do because patients really are happy with them. They're able to get back to their normal activities and lifestyle, and I think they give me more kudos than any other procedure that I do, and I really enjoy doing them.
If you'd like more information about breast augmentation at the Broadway Center for Plastic Surgery, just give them a call, 303-680-8989, or go online to BroadwayPlasticSurgery.com.